So he was born with bilateral microtia, and most parents never even know this is a possibility. And so the first time these families are meeting anybody with microtia is usually their own child. He has bilateral aural atresia, which means that he has no ear canals on either side either, which prevents him from hearing in the way that most of us hear through our ear canal and eardrum. So when I started training, I finished training about 13 years ago, we were doing 4-stage reconstruction for microtia, which involved 4 separate procedures spaced apart by 3 to 4 months. Over time, across really the world, people have transitioned towards 2-stage microtia reconstruction, so only 2 separate operative episodes for each ear. Now this patient, it's unique in that they really desired to escalate the time frame so that we could address both ears in those 2 stages. And so this had been done previously in England and in China, but had, to my knowledge, not yet been done in the United States to do a 2-stage rib reconstruction for microtia. So 13 years ago, we would have done 8 surgeries for this procedure potentially. We might have been able to combine some of them to reduce it to about 6, but in this case, we were able to accomplish both ears, ears that look good and functionally can hear as well in 2 surgeries. Yeah, the most common procedure done for microtia reconstruction across the world is rib graft reconstruction. And so that involves making an incision over the 6th, 7th, and 8th ribs, taking out the cartilaginous portions of those ribs, and then it's really sculpting work. We take the ribs and we carve them to be the shape and attach the different carvings together to form a 3-dimensional model of what we want to be for the ear. We then make an incision near the ear and rotate some tissues around that the patient is born with to act as the earlobe for the ear, and then implant the cartilage model that we have made. That allows us to have good skin coverage over the cartilage that we have sculpted, and we allow that to heal and to be in place for about 4 to 6 months. And then we can go back and make an incision around the ear to create space behind the ear, as well as to place a hearing implant to allow patients to be able to hear sounds that are then picked up by a microphone on the outside and sent to a vibrating mechanism on the inside so that can stimulate the inner ear to allow the patient to hear.